Welcome to today's video about early signs of cancer. Did you know that according to the World Cancer Research Fund, there were over 19 million new cases of cancer reported globally in 2020? But what if our bodies have been whispering warnings to us way before we become part of this staggering statistic? What if the secret to fighting cancer lies hidden in plain sight, woven into the fabric of our daily lives, lurking in symptoms we often ignore? Could that unexplained fatigue, persistent cough, or sudden weight loss be subtle, silent screams of cells in distress? In today's video, we're peeling back the layers of mystery that shroud the early signs of cancer. We're diving deep, unveiling truths, and arming you with crucial information that could stand between you and this devastating disease. Stay with us as we unravel the signs your body might be signaling to you, signs that are easy to overlook but powerful enough to make a world of difference in early detection and prevention. Are you ready to embark on this life-saving journey? Let's uncover the hidden messages our bodies send us right here, right now. Please note, this content is for informational purposes only and is not a substitute for professional medical advice, diagnosis, or treatment. Always consult with a healthcare provider regarding any medical conditions or concerns. Let's dive into the list of early signs of cancer. Here's the first one: change in bowel or bladder habits. Certain cancers, like colorectal or bladder cancers, directly impact the functioning of our bowels and bladder. A tumor growing in the colon can obstruct the natural flow of waste, leading to persistent constipation or diarrhea. Similarly, bladder cancer might cause blood in the urine or changes in urinary frequency. A 2019 study in the Journal of Clinical Oncology emphasized that nearly 50% of colorectal cancer patients reported changes in their bowel habits before diagnosis. You might be thinking, is every bowel change a sign of cancer? No, not always. There are several non-cancerous reasons like infections or IBS, but if these changes persist, it's crucial to listen to your body and see a doctor. It's all about catching things early and staying informed. Next, number 2, sores that do not heal. Sores that do not heal could be a warning sign of cancer due to the body's diverted resources. When cancer is present, the body prioritizes sending nutrients and immune cells towards the tumor, leaving less for wound healing. In a study published in Frontiers in Immunology, 2020, researchers explain how tumors can hijack the body's healing process, manipulating the immune environment to promote their growth. This disruption makes it harder for regular wounds, like sores, to heal as quickly or effectively as they usually would. It's a subtle sign, but one that shouldn't be overlooked when considering your overall health. Next, number 3, unusual bleeding or discharge. Unusual bleeding or discharge can be alarming, and there's a reason for that. When cells transform and become cancerous, they may invade nearby tissues and blood vessels. This invasion often leads to bleeding. For instance, colon cancers can cause small amounts of invisible blood in the stool, a fact highlighted by a 2018 study in the Journal of Clinical Oncology. Similarly, endometrial or cervical cancers can trigger abnormal vaginal bleeding. And it's not just about blood. Some cancers, like ovarian, might lead to abnormal discharge due to fluid buildup. A study in Cancer Research from 2019 emphasized how early detection through recognizing these symptoms can save lives. Always listen to your body, and if something feels off, see a doctor. They're your best ally in this fight. Next, number 4, thickening or lump in the breast or other parts of the body. Recent studies highlight the importance of noticing thickening or lumps in the breast or other body parts as an early sign of cancer. A palpable mass or unusual thickening can be a tumor, and many times, it's the first noticeable symptom. When cells grow abnormally, they can form a lump or mass. Not all lumps are cancerous, but they all warrant medical evaluation to ensure that if it is cancer, it gets treated as early as possible. It's a red flag that shouldn't be ignored. Getting it checked can make a significant difference in treatment outcomes. Remember, early detection is a powerful weapon in the fight against cancer. Next, number 5, difficulty swallowing or chronic indigestion. Difficulty swallowing or chronic indigestion can be alarming signs, often linked to cancers of the esophagus, throat, or stomach. These symptoms arise when a tumor impedes the passage of food or irritates the lining of the digestive tract. A study in the journal Cancer Epidemiology, Biomarkers and Prevention, 2022, emphasized that persistent dysphagia is crucial for early cancer detection, enhancing the urgency for diagnostic procedures. Here's the reality. Encountering these symptoms doesn't confirm cancer. However, experiencing persistent discomfort necessitates a professional consultation. Through timely action, potential risks can be mitigated, illustrating the pivotal role of awareness and proactive health management in cancer prevention and early detection. So if swallowing becomes a consistent struggle or indigestion persists, seeking professional advice is the way forward. The aim: swift, decisive action for health's sake. Next, number 6. Change in warts or moles. Changes in warts or moles can indeed be early signs of skin cancer, particularly melanoma. When the cells in a mole or wart begin to grow uncontrollably, it could signal a transformation from a benign to a malignant state. You might notice changes in size, shape, color, or symmetry, or experience itchiness or bleeding. These alterations are driven by mutations in the DNA of skin cells, often due to UV radiation exposure. Scientists have detailed these changes in studies published in reputable journals like the Journal of the American Academy of Dermatology. Regular self-examinations and dermatologist consultations can play a crucial role in early detection, increasing the chances of successful treatment. Next, number 7. Cough or hoarseness that persists. A persistent cough or hoarseness can be alarming signs, subtly hinting at a potential underlying issue like lung cancer. When cancerous cells invade the respiratory tract's lining, they irritate and inflame the area, leading to a chronic cough. Research has illuminated this symptom as a key early warning sign. For instance, a study in Cancer Journal 2020 identified a persistent cough in 57.7% of early-stage lung cancer patients. Additionally, hoarseness can signal that a tumor is pressing against the laryngeal nerve, affecting voice quality. Recognizing and acting on these subtle symptoms early could be a pivotal step toward timely and effective treatment. Always remember, your health is paramount. Consulting a healthcare professional promptly ensures that you're on the right path to proper care and recovery. Next, number 8. Unexpected weight loss. Unexpected weight loss is often mentioned in the context of cancer, and you might wonder, why? Well, when your body has cancerous cells, they can consume a significant portion of your body's energy. A tumor's aggressive growth might use up your body's energy reserves, causing you to drop pounds without even trying. Additionally, certain cancers release substances that alter the way your body processes food. For example, in a 2018 study published in the journal Nature Medicine, researchers discovered that some tumors produce a protein that accelerates fat breakdown in the body. Combine these factors, and it's clear why unexplained weight loss can be a sign to look out for. Stay informed and always consult a medical professional if you notice drastic changes in your weight. Remember, knowledge is the key to proactive health management. Next, number 9. Fatigue. Fatigue as an early sign of cancer is a concerning symptom that should not be overlooked. Medical research suggests that cancer-related fatigue is due to the body's reaction to the disease and its treatment. The presence of cancer cells interferes with the normal function and energy levels of healthy cells, causing a feeling of tiredness or exhaustion. It's more than just feeling tired. It's an overwhelming sense of weariness that doesn't improve with rest. The body is working overtime to fight off the malignant cells, and the immune response activated can also contribute to feeling fatigued. If you're experiencing persistent fatigue, it's essential to listen to your body and seek professional medical advice. Next, number 10. Pain. In understanding why pain can be an early sign of cancer, let's delve into the underlying processes. When cancer begins to develop, it might invade nearby tissues, bones, or nerves, leading to discomfort or pain. A tumor can also release substances that trigger inflammation and sensitivity in the area, causing a painful sensation. Research, such as a study published in Cancer Research 2017, illustrates that pain receptors in the body can be activated by changes due to the presence of a tumor. This phenomenon helps explain why pain isn't just a random occurrence, but a signal that something could be wrong internally. When you experience unexplained, persistent pain, it's a message from your body urging you to pay attention and seek professional medical advice. Next, number 11. Skin changes. Skin changes are often overlooked, but they can be crucial early indicators of cancer. Let's dive deeper into why this happens. Some cancers, like melanoma, originate in the skin cells and manifest as changes such as new moles or variations in existing ones. Others, like breast and lung cancer, might lead to yellowing or darkening of the skin due to substances they release that affect the liver or kidneys. In certain cases, a phenomenon called paraneoplastic syndrome occurs where these changes result from the body's immune response to the cancer, not the disease itself. The essential takeaway here is, pay attention to persistent skin changes and discuss them with a healthcare professional for early cancer detection and intervention. Next, number 12, change in appetite. A change in appetite can be a subtle early warning sign of cancer. This alteration often stems from the body's reaction to the disease or tumors utilizing the body's nutrients, leaving less available for maintaining a healthy appetite. According to a study published in Cancer Epidemiology, Biomarkers and Prevention, 2021, metabolic changes induced by the tumor can directly affect hunger hormones, altering a person's desire to eat. Additionally, the immune system's response to cancer can also lead to a decreased appetite. Knowing these signs is crucial, as early detection can be a pivotal factor in the effectiveness of treatment strategies. So, listen to your body's signals. Even minor changes like appetite loss deserve attention and a consultation with a healthcare professional. Next, number 13, night sweats or fever. Night sweats or fever can sometimes be subtle signs of cancer because the body is reacting to the presence of malignant cells. In some cases, cancer cells release substances into the bloodstream that influence the hypothalamus, the part of the brain that regulates body temperature, causing fever. Moreover, cancer can trigger the immune system to react, increasing the body's temperature as it tries to fight off the disease. It's not about alarming you, but guiding you to listen to your body's signals. If persistent fever or night sweats are making you uncomfortable, it might be time to consult your healthcare provider for a closer look. Our journey through the labyrinth of early cancer signs doesn't end here. Consider this a starting point, a beacon, guiding you towards a horizon of awareness and early detection. Remember, knowledge is a powerful weapon, and by equipping ourselves, we hold the power to tilt the odds in our favor, don't we? What you've learned today could be a lifeline for you or someone you cherish, so why keep it to yourself? Share this video, spread the word, make an impact. Let's create a ripple of awareness that echoes through lives, communities, and generations to come. But the conversation doesn't stop here. We want to hear from you. What are your thoughts, questions, stories? Drop them in the comments below, and let's fuel the dialogue that sparks enlightenment. Before you go, hit the subscribe button, become a part of our community, and stay updated with reliable information that empowers you in the battlefield against cancer. Until next time, keep listening to your body's whispers and stand steadfast as a guardian of your health. Together, we are stronger.